How do genotype and phenotype affect cystic fibrosis? Imagine your genes as a set of instructions that shape how your body works. In cystic fibrosis, the specific instructions in the CFTR gene are altered by mutations. These mutations make up the genotype, which is like the genetic blueprint a person inherits. The genotype directly influences the phenotype, which is what you actually see and experience in the body. But this relationship is quite complex. Cystic fibrosis is caused by mutations in both copies of the CFTR gene. This gene produces a protein that helps control the flow of chloride ions in and out of cells. When the CFTR protein doesn't work properly because of mutations, thick and sticky mucus builds up in organs like the lungs and pancreas. Different mutations affect how well the CFTR protein functions, leading to variations in disease severity and which organs are impacted. The phenotype of cystic fibrosis includes symptoms such as lung infections, difficulty breathing, pancreatic problems, digestive issues, and abnormal sweat gland activity. How severe these symptoms are can differ widely from person to person. Some may have mild lung issues but significant digestive problems, while others might experience more severe lung disease with milder pancreatic symptoms. There is a strong link between certain CFTR mutations and pancreatic function. For example, about 85% of people with cystic fibrosis have pancreatic insufficiency, which is often associated with specific mutations that severely impair the CFTR protein. On the other hand, around 15% retain pancreatic function, typically linked to milder mutations. However, the connection between genotype and lung disease is less clear. Even people with the same mutations can have very different lung health, because other factors come into play. Environmental influences like pollution, smoking, infections, and nutrition also shape the disease's course. Additionally, other genes called modifier genes can influence how cystic fibrosis manifests. This means that even with the same genetic mutations, two individuals might experience different symptoms and disease progression. For genetic counseling, understanding the genotype helps predict certain aspects of the disease, especially pancreatic function. However, it cannot fully forecast lung disease severity or overall outlook because of the influence of environmental and other genetic factors. This is why counseling emphasizes the variability and the importance of personalized care. In summary, the genotype in cystic fibrosis sets the foundation by determining the type of CFTR mutation and its impact on the protein. This influences specific features like pancreatic function. But the phenotype, or how the disease actually appears and progresses, is shaped by a combination of genetic modifiers and environmental factors. Recognizing this complexity helps healthcare providers offer better, more personalized advice and management options. Always consult healthcare professionals for tailored medical guidance, as each person's experience with cystic fibrosis can be quite unique.